Hello, my name is October and I'm the Clinical Director at ICANotes. ICANotes is an electronic health record that will improve and add ease to your documentation. Follow-up notes can be done in 2 to 3 minutes time. We have a full system that not only includes our professional documentation, but it also includes reporting, scheduling, and billing. We have over 25 reports in our system with demographic fields that can be cross-referenced to find customizable reports. In ICANotes, we also have an advanced scheduling system. Our calendar is able to house multiple clinicians with 7 full days of scheduling. You're able to schedule individual, family, and even group therapy with full rosters on our calendar. Our scheduler is intuitive and pulls information from each chart so you can see balances and collect copays on your patients, all from the calendar interface. Our billing and patient account areas of the program are very advanced. You're able to create claims and send them to an electronic clearinghouse, and ICANotes notifies you when claims have not been checked or are not ready to be sent and need additional information. You can easily fix those claims right in the work areas. This prevents you from having to go back into the chart and waste unnecessary time. In the patient accounts area of ICANotes, you are able to view, create, and customize individual or batch statements within the program. In ICANotes, we make finding patients easy and simple within the program. You simply select the drawer, find your patient, and click on their name, or I can search in the toolbar at the top. I can also search for another patient on an existing patient's chart face using the search tool. Right now, I have a chart flag message that has appeared. This is in Raymond Reddington's chart, alerting me that he is a Medicare patient, and I will need to do things for MIPS to make sure that I meet my percentages. I'm going to go ahead and close this chart flag, and then I'm going to go directly into the client's chart to create a note. Notice on the chart face, I see the client's diagnosis, I see all the current medications, and I can print a list for the client. I see the adverse drug reactions, the patient notes and risk factors, and also the chart reminders. This helped me remember things about the patient, such as the daughter is the patient's guardian. All progress notes and all notes and consents of any type are kept here in the notes section of the chart. I can filter through these, just showing only the notes that I would like to see and individually breaking them down. I also have the ability to see the most complete evaluation, the most recent progress note, all the documents on the patient, so under the Documents tab, and I'm able to filter those. And then I have a log section where all the medication is kept for my patient, so I can look at all the medication ordered. I can also look at all the lab results. I can look at the problem diagnosis log. Under the problem diagnosis log, I can look to see the problems that the patient has, and I can print patient information from Medline Plus. By simply hitting the print button, it will then give me credit for giving patients education. I am also able to search for vital signs within the patient's log, and I can trend those over time using bar or line charts to trend the vital signs out for this patient. We also have a comprehensive rating scale log along with a plethora of rating scales within our system. When I click on rating scales, I can see exactly the encounters the patient has had and how they have scored out and trend using the PHQ-9. Within ICANotes, we have many custom forms and assessments, including general custom forms along with adult assessments, and we have child assessments within the program. You can pick your favorites, and patients are able to sign these assessments after they are completed. To create a progress note within ICANotes, I simply use the Progress Note Prescriber button. I am then entered into the simplified Progress Note work area. I'm going to start at 1 and work all the way through 6. I am going to pretend that my patient has gotten better and is doing much better since they last saw me. I'm going to go ahead and start on clinical complexity, and I will say that they are improving. Then I will go down into symptoms. My patient previously had a diagnosis of depression. I will go into C-list, and I'm going to say that the depression today is absent, that the frequency and duration is it's episodic, it's just a few times a week, and the mood lasts for hours. Better, same, or worse, I will indicate the patient is better, and symptoms such as crying spells are much better, fatigue, is much better. Sadness is greatly improved, much better. And I will say that they're no longer suicidal, and that denial is convincing. Then I will go back to my note. I can go into Psych Testing, and I'm going to say that they completed a PHQ-9, and now their PHQ-9, they scored a 6. This will then track this on my rating scales log, and then I can go and talk about behavior. I can go into C-list, and we can go through the patient's behavior. I'm going to say that they are taking their medication regularly. Their self-care is normal now. They've been socializing with others, but it's still somewhat reduced. Their functioning at work is still somewhat impaired. Substance uses, I'm going to say that they've maintained sobriety. And I can highlight that their intake of food and water has been normal, but they have reported some sleep problems, falling asleep and staying asleep. Notice in the program I only use the buttons that apply to my patient. I go back, and each area indicates with a red check mark that I have completed the note. I am going to say that there are no side effects at this time. I can go in and do individual therapy if I'd like. We have a list here, so I can go in and say that we talked about some feelings of frustration and depression. And then I can continue on, and I can say that we're working on improving coping skills, and we're doing that by support and stress reduction techniques. But I also encourage the patient about the importance of compliance of medications. And we had a 20 to 30 minute therapy session, and I can continue on. Now I can go into my MSE, I can go into C-list, and I can do a thorough MSE. But if my patient is exhibiting no symptoms, I can use the normal MSE button, and that will then give a normal MSE. If they were previously on antipsychotics, I can go in and do an Ames exam. None of these abnormalities have been noted previously, where the boxes would have maintained and the minimal or mild or moderate or severe buttons, but I can move forward, and I can also set another due date for my Ames. Going back into the note, and there my Ames is placed on my note as well. Now, I can continue on to part 2 of my note. I can check all the medications here. In the medication entry area, I can add or change a medication. Since the patient reported poor sleep, I can go ahead and start some Ambien for this patient. We can say 5 milligrams, PO, QHS, 4 to dispense 30, no refills, 30 days, and this would be for insomnia. You're able to free text in these medication areas, and I can print a script. We also have e-prescribing in the program, which is very easy to use. ICANotes has a unique feature in which our program can code for you. It is called E&M Code for Me. I simply click E&M Code for Me, and then it will provide me with a 99213. We have a coding matrix within the program that will be able to determine your codes, show you what you have and have not done, and how you can achieve a higher code within the program. After compiling the note that we just created, I have a very nice note. It has my symptoms, my PHQ-9 test, my behavior, my mental status exam, my Ames exam that was performed on the patient, all the diagnosis, the therapy and clinical content, as well as all the medications, including bolded what we started today. The program will also let you know that certain medication was not signed off when given a verbal order, helping you to be in compliance. Within our system, we have an advanced patient portal and secure messaging. At ICANotes, we don't try to lock you into a long-term contract. We want to make sure our customers are enjoying using our system. Therefore, we give you the ability to leave at any time, and no hefty payouts are required. We also have advantages that other electronic health records cannot provide. We offer training and support for free. That's right, no cost to you as the customer. So if you're concerned that starting a new system may be hard and perhaps you're not the best at computers, well, we're here to help. The inexperienced computer users to the most advanced experts learn to use our system. Again, our training and support is unlimited and free. Thank you for taking your time today to view our system. I hope you have a wonderful day.